Hi, I'm Ozer with Texas Diabetes and Endocrinology in Austin, and I'll be talking about COVID-19 and diabetes today. When we think about COVID-19, it's important to realize that this is a very new, heretofore unknown condition. So things are changing very fast. Information is changing very fast, and this is a fluid situation. So we always want to make sure that that you're staying in touch with your healthcare providers and getting the most up-to-date information. Based on what we know so far, it does not look like people with diabetes are more likely to get COVID-19 than the general population. With the limited experience we have so far, it does look like if someone does have diabetes, they may be more prone, they may be at a higher risk to develop complications related to COVID-19. If someone has diabetes and their diabetes is not well managed, they may be at a higher risk for diabetes complications, and this could potentially increase the risk of developing virus-related complications as well. Whenever someone with diabetes is sick for any reason, including something like COVID-19, they are at an increased risk to develop diabetic ketoacidosis. Is there a difference in the risk of developing COVID-19 complications in patients with type 1 diabetes versus type 2 diabetes? And so far, it does not look like there's a significant difference there. However, people who have had diabetes-related health problems, including heart disease, may be at an increased risk of developing COVID-19 related complications. If you're living with someone with diabetes, since they may be at a higher risk of developing COVID-19 complications, we want to reduce their risk of contracting COVID-19. We want to make sure that everyone is following social distancing. We want to make sure they're washing their hands appropriately. We want to make sure people aren't touching their faces. And if a member of the household is sick with COVID-19, they want to have their own room, have only one family member care for them, maybe even consider providing additional protections, especially if the person with diabetes is over the age of 65. We always encourage people with diabetes to follow the guidance of the Centers for Disease Control, the CDC, and to review how you manage your sick days. General sick day preparation recommendation from the American Diabetes Association: you want to make sure you have a list of contact information of your healthcare team, your pharmacy, contact information for your insurance, list of medications and their doses, having some simple carbs on board to be able to effectively manage low glucose levels. If you have glucagon, keeping that on hand is very important. Always having enough insulin for the week ahead is important. With insulin so far, when we look at insulin manufacturers, it does not look like they're concerned in the short term about a shortage of insulin. It's also important to keep in mind when you should be calling your doctor's office, things like ketones, changes in food intake, sick days, medication adjustments, how often you need to check your blood sugar. We want to personalize all that by making sure you're talking to your healthcare provider. Medications that may be used for colds, flu, or viral infections, and any changes to diabetes medications when you're sick. If anyone develops emergency warning signs of COVID-19, it's very important to get medical attention immediately. In adults, emergency warning signs include difficulty breathing, shortness of breath, fever, persistent pain or pressure in the chest, confusion, inability to arouse, bluish lips or face. Sick day management. We want to make sure that people with diabetes are staying well hydrated. We want to make sure that if the blood glucose is greater than 240 milligrams per deciliter, more than 2 times back to back. You want to check for ketones and avoid DKA. And call your healthcare provider immediately. To add to sick day management, we want to make sure that everyone's aware that some glucose sensors can be affected by acetaminophen or Tylenol. So if you're experiencing unusually high or low glucose levels, you want to make sure you're checking with finger sticks to ensure accuracy, and making sure you're keeping your hands clean, keeping your injection infusion sites clean are very important as well. Also remember that there's plenty more information on the Cardiovisual app through our educational videos regarding checking blood sugar levels, continuous glucose monitoring, insulins, and other types of diabetes medications.